For oral care, everything you need for 24 hours is located in this kit. Included is the subglottic suction, the chlorhexidine bottle with the toothbrush and the mouth swab, the oral care suction kits, and a yank hour for other secretion suctioning. The suction canister will have a setup with a dedicated line to the ET tube and a dedicated suction line to the oral care and toothbrushing care system. You will find the oral care kit located at the head of the bed. First step would be to wash your hands, don clean gloves, and put on a mask with a face shield. Position the patient to the head of bed at least 30 degrees, unless contraindicated. Higher is better. The first step of your oral care assessment would include finding a flashlight, requesting the patient open their mouth, and do a thorough assessment of all surfaces of the oral cavity. Assess for any dried secretions, mucosal ulcerations, lesions, loose teeth, or any debris. For the purpose of this video, our patient is not intubated, but for all intubated patients, start with subglottic suctioning. This ensures secretions are removed from the cuffed trach, preventing any debris from leaking down into the trachea. At Q12 hours, open step 1. Remove the bottle of chlorhexidine and dump contents into the basin. We will then use the toothbrush with the soft pads on the edge to apply the chlorhexidine all throughout the oral mucosa. Remove the toothbrush and attach it to the suction canister. Insert the toothbrush into the oral cavity, placing the swab perpendicular to the gum line, and apply gentle mechanical action. This process should take approximately 1 to 2 minutes, with focus both on the lingual surface of the teeth and the gingival surface of the teeth. Then direct your attention to both the surface of the tongue, under the tongue, and to the roof of the mouth. For the roof of the mouth, start towards the back of the soft palate near the uvula and bring the secretions forward in a turning motion. This allows for removal of excess secretions and debris from the oral cavity. Feel free at any point to rinse off the toothbrush or the swab and return to the oral cavity for further removal and cleaning. Exert gentle pressure while moving in these short, horizontal, and circular strokes. At Q4 hours, use the next packet for oral care. Pop the oral solution into the packet. Open and attach to the suction catheter. Request the patient open their mouth and begin oral care. Start on the roof of the mouth, back towards the uvula, and bring forward in a turning motion with suction to the front of the palate. Do this from left to right. Then repeat these same steps onto the tongue. Place the swab perpendicular to the gum line and apply gentle mechanical action for 1 to 2 minutes on both the lingual surface and the outside gingival surface of the teeth. Bring forward all debris to avoid any of the debris from going deeper into the oral cavity.